Okay, I think most people are in, so welcome everybody. Thanks a million for joining us this afternoon. My name is Denise Charlton. I'm Chief Executive of the Community Foundation for Ireland. And as you know, we're hosting today's conversation with the Children's Rights Alliance. And we're really delighted that you could join us. I guess just to say a couple of things before some housekeeping and then some comments from us as CFI. We wanted to have this convening as we, I suppose, go from emergency to recovery. So all of us are aware as the country starts to open up again that there were challenges in the emergency phase of the pandemic, but there's going to be serious challenges also in the recovery phase. And that some of the inequalities that were there before the pandemic that have been exacerbated by it are joined by some new inequalities and challenges, and food poverty, I think, spans across that, and so food poverty and food insecurity. So really delighted to join CRA and all of you in having a discussion, I suppose, on what are the issues, what are the complexities, what are the problems, and then maybe some of the solutions, and maybe how we can partner with you going forward with our donors. We're going to do it in the format of a panel discussion. So we have a fantastic panel joining us this afternoon, and they're going to introduce themselves and tell us a little bit about the work that they're doing, and then we'll go into a Q&A session. We'll then open it to the floor, as they would have said in the old days. We'll then open it to the screen, and if you use the hand signal, I will come to as many of you as I possibly can during the discussion. If I don't get to you and you feel you have a lot to contribute and to say, please get in touch with us after the webinar as well, after the discussion, and the same with opportunities. We'd be delighted to hear from you at any stage at Community Foundation. So all of you in the room, we have obviously people and organisations who've been working on the the related issues for many years. And you have real idea and sense of the complexities and the related context. So we're really interested in hearing about that today. In a moment, we'll hear from Tanya Ward, our partner this morning. But before we do, I suppose just a couple of observations from ourselves. As you know, we've been partnering with the voluntary community sector for over 21 years. We work with about 5,000 organisations, and we partner with many, if not all of you that are here today. And I suppose what we try and do, what we attempt to do, is to listen all the time and have connectivity with the sector so that we can inform our donors where you think the most need is and where you think the most benefit of our involvement and our engagement is. And so we really appreciate that always. Suffice to say that when the pandemic hit, it was, I suppose, that partnership that allowed us to pivot and adapt our own organisation. And with the setting up of an emergency fund, our donors really stepped up to the plate and got very involved. And we saw a real growth in the investment that they were prepared to give. We went from, I think, 8,000 in 2018 to 8 million to 15 million, and 9 million was COVID related. So having the emergency fund, I suppose, really allowed us to partner with you in terms of COVID, and we want to keep doing that, as I said, as we go to the recovery. What we're hearing is the same as what all of you are hearing, is that overnight families have had their incomes wiped out. That because of, I suppose, underlying conditions, isolation, various different contexts for families and individuals all over the country have food poverty, which was embedded already, has become even more systematic and more persistent, I suppose, than it was in the past. We were able to, suppose, work with, I think it was 43 organisations, and again, we were listening to people saying to us that the provision of food was, there was an increasing demand for the provision of food, for the quality of food, that the context or the ability of organisations to provide it had changed, and that some of the solutions now are already available but need investment. So we are really looking forward to hearing from you on that. I think the UN put it out there that they're putting the challenge that it's not just about recovery, but it's about recovering better. And I suppose that's what all of us in the room here today are trying to do in Ireland, is to support the inequalities that are there and recover better than we have. We are, as you know, work a lot with kind of an evidence base. And so we were partnering the ERSI in their research this week that was launched on poverty, income inequality and living standards. And that research, no surprises in it for anybody, I suppose, talked about that some of the interventions over the years have actually worked, but the fear that the pandemic will regress those, but also put a spotlight on young people and the generation that have really been unduly affected by the pandemic. And again, I suppose the context of that poverty in young people, and then the issues such as food poverty within that. So it's really important for us to hear that. And then actually Social Justice Ireland said that they believe unemployment levels of unemployment will be even higher. They believe that they'll be worse than they were in the 80s. And for those of us that are old enough, that will cause a shudder, because obviously that was a terrible time. But actually, in addition to the research, what is really helpful to us is to get the real-time insights that you all have. So to, I suppose, add value to the research and the evidence that's there, you have the real-time information from the ground that really, I suppose, informs the solutions and what is needed. This session is being recorded, just to let you know that. So if anybody doesn't want to be seen, just to keep your camera off, and if you want to put your question into the chat box, we'll try and come to you then. The end of the conversation, I suppose the emphasis for us, of course, is how philanthropy can help. So our panelists are going to help amplify what the issues are, and they're going to help us, I suppose, unpack what is the issues in relation to food poverty and insecurity that have been embedded and are systematic and have been there for a long time, and what are the new, I suppose, manifestations of it since the pandemic. But our lens, of course, is what and how philanthropy can help, and how we as a foundation can partner with you. So our first speaker I'll introduce is our co-host, the CEO of the Children's Rights Alliance, Tanya Ward, who probably needs no introduction in the room. I've had the privilege of working with Tanya and the Children's Rights Alliance for many years. I watched them navigate No Child 2020, and the result was real outcomes and changes for children. One small example of what they do on an ongoing basis, and I know many of you are members. The report card that we've been lucky enough to help them with over the years is just so successful and held up, I think, as a system of working in partnership with government while holding them to account. Small examples, there are many, many examples of their leadership and the fantastic work that they do. So I'm going to hand over to Tanya Ward. Thanks, Tanya.
Great, thanks Denise for that introduction, and it's great to highlight the work in No Child 2020. And what Denise didn't mention was she was a strategic advisor on No Child 2020, and is one of the key reasons why we achieved so much through that campaign, and we were just really lucky to have Denise on that work. So look, I'm delighted to have a chance to talk to you about something that really matters for us in the Children's Rights Alliance, which is food poverty. And we really welcome the fact that the Community Foundation is actually putting a spotlight on this and is looking at this as a particular area that it's going to fund potentially into the future and try and bring philanthropy into it. And the reason for that is, you will know, food poverty is probably one of the most serious aspects of child poverty in Ireland. It has an enormous effect on children and young people because they are going through a period of growth and development in their lives, and food nutrition has a huge role in relation to that. The impacts of it on children is so serious. We know, for example, in small children, it makes them feel unloved when they're not fed properly. We know it affects their growth and development. It can make them very irritable. But we know in older children, for example, it really affects their cognitive and brain development. They don't do as well in school. They start school later. They don't do as well in school. They're more likely to drop out of school if this basic need isn't met. And we know also that it has a big effect on their weight. The Irish Heart Foundation will be able to tell you we have this extraordinary development in Ireland where you have high levels of malnutrition and high levels of obesity in small children. It's one of the big indicators of poverty when you look at countries' overall statistics. Now, if you look at our statistics, our CSO statistics, and what it says, we don't really have a direct measure of food poverty in Ireland per se. There's no measurement that tells us this many children are exactly hungry. But we do have Central Statistics Office data. It's called the EU SILK data. It's based on a household survey that it's done with families throughout the country, and they're looking at deprivation indicators. And it gives us some insight as to what's probably happening for families at home. So, for example, it says families can indicate whether they are able to provide a meal, maybe a couple of nights a week, if they're able to provide a meal with meat or an equivalent vegetarian with that meal, maybe a roast dinner, or if they're going to bed hungry. And what we know from those statistics is slightly more than 1 in 10 families are actually experiencing that based on those statistics. So that tells you potentially how serious that is. And most of you will know as well is that parents are obviously doing everything they can to shield their children when they are going through this. Now, within that group, what does that look like and why is that happening? We know there's a massive spectrum of need, from starting with families who can't manage incomes because they could be struggling with addiction issues. We know there are some families that have very poor cooking facilities. I remember one of the studies that shocked me most, and it came from the Irish Heart Foundation, brought it to my attention, but it was based in the Coombe, where they found small babies were being weaned on fast food, whizzed up fast food. And when they looked at why was that happening, it was the families actually lost the capacity to cook. But that's not the story for all families. And what you find at the other end of the spectrum for families who are experiencing this, it's simply about income. What's happened to them is that they are newly unemployed, or their rent is too inexpensive for them to pay. And the decisions that they make, what they end up doing is they decide to cut the food bill. So there's a massive spectrum of need within that. And any solution that we come up with has to take account of that. So if we look at the underlying drivers, the Children's Rights Alliance, at the request of the Community Foundation, has provided a paper in relation to this. Denise and the Foundation asked us, can you give us some more detail about what this problem is? And can you tell us what's driving it? And can you also tell us what the solutions are, so we can then look at where philanthropy can play a role? And there is a draft paper that has been circulated to you. We'd really encourage you to look at it and come back to us with any feedback, any recommendations, any changes that you might have. And I was just going to take you through, some of the solutions that our team has uncovered, but we're really interested to hear what you have to say. And obviously what we're doing is we're documenting today what you think is important and what role philanthropy can play in regard to that. But if we take it back to what's causing these issues, well, we know affordability of good quality food is one of the key drivers in this area. And we know that because Social Justice Ireland, or the Conventions, has analysed what a healthy food basket looks like. It's not, and this is the common misunderstanding among the public, and we know this in the Children's Rights Alliance because we did focus group work with ordinary members of the public, and that was funded by the Community Foundation for No Child 2020. It's not, the public think that families are misspending their money and that's why they can't feed their children. They don't understand that to actually feed your children with healthy quality food, you need a higher income to be able to do that. The other key issue we know is accessibility. If you don't have a good quality supermarket nearby, or you don't have transport, you don't have the car that allows you to drive from one supermarket to the other to get the right deals, your problem is you can't really benefit from it. And I still think it's absolutely staggering that a Lidl only opened up recently in Ballymun in an area of high levels of deprivation. So we know that this is something we need to plan within our communities. That's incredibly important. One of the other key drivers we know is, as I said, education awareness, really having the knowledge of how to cook food. There are small groups in our society that don't know how to cook healthy food anymore because processed food is so cheap, it's so plentiful. And another key issue is quality and what people have access to. We've documented that all in the paper, and we really want to get your feedback in relation to that. So in relation to some of the solutions, I'm just going to share a PowerPoint slide with you because I think it's easier to take you through that, what we think some of the solutions are. And the first one is really that national level piece. We know countries that get this right, they actually have a national food poverty action plan, because one of the key problems we know in this space, this falls between government departments. Obesity is obviously the concern of the Department of Health, child nutrition and well-being, the Department of Children, but food in itself is actually the Department of Social Protection. So there's a real need for a national food poverty action plan. Now, there's some very encouraging signs coming from Minister O'Brien in this space. He has his own working group. The Department of Health has a working group in this space. But this is one of the key things that we need to see happen. The other thing is also that local food poverty action plan. I mentioned, for example, Ballymun only getting its little very recently. If we actually had local action plans in place dealing with these issues, the local councils, businesses, agencies could be working to make sure there is a good quality supermarket that has been brought into the area to make healthy food accessible for the people living in that community. The other piece is, supporting those local agencies and organisations to distribute food that is tailored to the needs of families. Now, this is a really important aspect of the work, but you can't say you shouldn't really replacing income. But we know there are families out there that would really benefit from help with the shopping list, how to get the best out of your shopping, help with trying to make a healthy meal, and also who quickly fall in hard times do need some support. They need a safety net, and those programs are really important. Another piece that's really important is really scaling up best practice models in interagencies working at local levels. There's actually been some good examples of that. Many of you have experience of that. The local CIPSEs, the Children and Youth, Young Person Service Committees, have been involved in that with some funding from the Department of Health. Income. We have to be advocating for people to have sufficient income. As Denise has said, we have a serious problem ahead of us. We have a problem with people going to be out of work. That is very serious because it's going to tell us that they won't have enough money to buy healthy, affordable food. And that's something that we have to focus on as advocates. The other piece then is that direct food provision, ensuring that children have access to a hot meal every day. We know in the countries that do this well, that's actually something, it's part of the school day for every child in the country. So every child gets to benefit, but obviously the most disadvantaged children get to benefit most. And that's something we absolutely have to push through and try and make national. Holiday hunger is another key issue, and holiday hunger happens at Christmas as well. It just doesn't happen in the summer months. But we know, for example, that there are some children and young people that they are living from day to day based on what they're getting from their schools. I have met children myself, some of those young people who work with children in care work with, and some of those young people have told me the only meal they were getting in the week was the meal they were getting in their local school. And this is something that we have to think about when we're thinking about the coverage around the summer months and Christmas periods. And as I mentioned, the food banks, the kitchens, the food parcels, very important for families who are really experiencing food poverty for the first time in their lives, but also those who are really struggling with managing incomes. So there's more detail on all of these solutions in the paper. Really interested to get your reflections today on those solutions. And also, if you want to send any recommendations, observations to the Children's Rights Alliance, you can contact Emma McKinley in the Children's Rights Alliance after the fact. So really interested to hear what you have to say. And what we're going to do is write it all up and present it back to the Community Foundation, and hopefully they'll be able to take action in relation to that. So thanks very much.
Great, thanks Tanya, and thanks for bringing us through that so succinctly. And just to echo that invitation, once the CRA add to the really quality paper that they've already provided, that I suppose from our perspective really outlines the issues but also the solutions. And as Tanya said, we'll be listening very carefully and adding to that, but there'll be a chance afterwards as well if you feel that you didn't get your chance today. So I'm going to move now into the panel discussion, and we have a fantastic panel. I'm going to get each one of them to introduce themselves, and they're going to talk a little bit about the context that they're working in related to this issue. They've 3 minutes each, which isn't long, but then we will have time for questions and answers, I suppose, to unpack a bit more what they're putting before us. And then, as I said, then we'll go back to the floor. So I'll just go through the order that we're going to go through. First of all, we Seamus Boland from Irish Rural Link, Emer Delahunty from Food Cloud, Bridget Quillihan from Kerry's Travellers Health Community Development Project, Tanya Hanley, Principal at Our Ladies Lourdes National School, and Eileen O'Coof, Ballyhora Development CLG, and member of the Local Development Network. So as you can see, a whole range of different perspectives and expertise in relation to today's conversation. So Seamus, I'm going to start with you.
Good afternoon. Good afternoon. Thanks very much. Okay, Seamus Boland, CEO with Irish Rural Link. I suppose our interest in this particular subject came because we are a national organisation, but in the last few years we've developed various networks, and one of the networks that has really come to play is the Meals on Wheels network. I think when we started, we realised back in 2012 or 13, that there was a certain need for people living in isolated areas to have food prepared for them, either because they're recovering from illness or because they are unable to sort out their own cooking, or a range of issues. And it applied to a number of different family units. It could be the single person living alone, the one-parent family, people with disabilities, a range of reasons why this happened. And most of the groups that we managed to became in touch with were small groups of voluntary people who were actually organizing these meals and trying to, as it were, deliver them in such a way that they were perfect, that they worked, and all of the rest. And remember, sometimes they were delivering a meal maybe 20 kilometers up a mountain, which if you really put the cost in terms of how much that meal really cost, you'd be talking about 50 or 60 euros or more. But I have to say, in the last year and a half, and really COVID is driving this, the network, which is now containing some 300 members, we're talking about 144,000 meals per week delivered. And that is an extraordinary number of meals. And thanks to the Community Foundation who've helped us out in that. But one of the things that struck us in this was that these are people effectively outside the system. And I said they cover all family units and all ages. But they're outside the system because the normal system doesn't seem to be able to actually reach them in the normal way. So that means you have very unusual and out of the box ways in which communities, local organizations, mainly women, who actually prepare these meals, deliver them, etc. And as you know, that has its own discipline, because you cannot deliver meals unless they're properly sourced, properly prepared, and of course contain no allergies, etc. So there is a discipline, and therefore with that group we're already doing a study which with the HSE which shows the complexity of this situation. So I suppose in a nutshell, Denise, that would be our introduction. And I suppose the final part I'd say to this, yes, it is about food poverty, and we've certainly discovered that in quite an amount. But it's also about befriending. It's also about bringing information to these households that they are looking for as well. So over the last year and a half, the network that comes under our heading have been certainly busy.
Great, thanks Seamus, and absolutely. So people outside of the system, the changing contacts for them, and then the importance of having wraparound services in relation to quality and the provision of food. Thanks so much, Seamus. I'm going to move on then to Emer.
Okay, so hi. So I work in community development with Food Cloud. Emer Delahunty is my name. So just briefly, Food Cloud is a national food bank in Ireland. We provide food that is donated to us from the food industry and distributed out to charities and community groups across the country. We do this in two ways. In one way, we do it in partnership with retailers, small little retailers across the country who donate directly to charities and community groups and have been doing for many years now. The food that they have that's surplus to their needs any day. And then we also have 3 warehouses that we have situated regionally across the country, where we distribute larger volumes of food that has been donated to us from the food industry, either because it's surplus food or because we have gone out looking for food donations. So the kind of landscape of who we work with is quite diverse. We work with any organization basically who is a charitable, has charitable purpose and who wants to use food, and we kind of support them in terms of food safety and that kind of thing. The kinds of organizations are daycare centres and childcare centres, small community food banks do pop up all over the country as well, but also homeless hostels, residential centres, schools, education programs. So like a really diverse network of organizations out there providing food in very different ways. And then what we saw last year was that this landscape changed slightly. So many of those organizations stopped doing food and closed their services, obviously because they had to protect the people that they were supporting and protect their volunteers. And then at the same time, other new organizations and organizations who we were already working with scaled up their food provision in terms of emergency direct food provision. So we saw a really massive change in how food was being supplied out to the community in the last year. I suppose from our partners' perspective, like we do engage quite a bit, and so one of the overarching, I suppose, themes that came out of last year is that a lot of organizations didn't necessarily feel like they were prepared for something like that. It sort of caught them off guard. A lot of organizations that we work with don't necessarily see themselves as organizations that work in combating food poverty, even though they already do offer community food services as core parts of their work. But generally, I think that we as an organization would see that all of those different kinds of approaches to food provision are actually ways of mitigating the risk of food poverty, but also providing that kind of emergency support that is needed out there. And I suppose just the last point I want to make is that what we saw last year was a scaling up and kind of a change of the landscape. But what is definite is that this need was there already, because there's organizations across the country who were giving out very informally direct food provision. And we know that because we work with a great deal of them. What we saw last year was a very acute rise in that need across the country. That's my introduction. Thanks, Denise.
Thanks, Emer. And again, I suppose just amplifying the changing concept landscape, particularly, I suppose, on the charity and voluntary sector more generally, where local organisations have felt the pressure in terms of being able to do what they were able to do, but then encouraging to hear the scalability as well of others, and then prevention obviously being core in terms of food waste and being able to, I suppose, maximise food surplus. So thanks a million, Emer, that's fantastic. Bridget.
Good afternoon, everyone. Thanks very much for having me here. I'm Bridget Quilligan. I'm a traveller woman from Killarney, and I manage a county-wide traveller organisation called Kerry Traveller Health Community Development Project. We operate from community development and human rights principles. So we would usually work with people. We have a health action zone hub, and we would work with people around peer education, peer health, empowering people, ensuring people are participative, I suppose, in various structures, whether it be around accommodation, education, and making sure that people have support and feel informed around access to services. And if there is a problem around access to services, they can also come to us to, I suppose, advocate or to source legal representation for them. Food poverty was something that we would have been aware of within our own community. We have approximately about 560 families in the county, in County Kerry, but a large number of those families are nomadic. So we have the second largest nomadic population in the country of travellers. So most of our community would go abroad for most of the year. And it's usually, it's for economic reasons rather than cultural reasons, although it does keep our culture of being nomadic people alive. We would have seen over the last number of years people struggling really badly because of the homeless crisis. So our own office in the last probably 2 or 3 years, we would always have had little things like beans and toast, or, you know, things available if anybody was coming in, soup, so that if somebody wanted to come in and they were filling out something, we would very informally and without taking people's dignity offer somebody something like to eat, because we would have been aware that people were hungry, particularly if they were in emergency accommodation or if they didn't have the facilities to eat. And we would usually refer them on to other agencies rather than providing food ourselves. This year,
I think we've lost Bridget there. Can everybody else hear her? No. Just give her a minute to see if it just corrects itself. Bridget, we lost you there for a couple of minutes.
Sorry about that. I don't know what's going on here today. The weather is really bad. It might have something to do with so I don't know. I suppose what I was saying was that changing our approach and changing our opinion came very much out of the need on the ground around providing food or being the people that were going to deliver food rather than referring people onto the regular agencies. And that was very much based on the need of the community and a crisis response. So I can go into later some of my thoughts around that in the questions that are going to come up. But suffices to say that it has been a very difficult year for the traveller community nationally, because if we were at a disadvantage before COVID, definitely, particularly our children, have massively suffered around food poverty, education and mental health over the last 18 months or 15 months.
Thanks, Bridget. And yeah, absolutely. So you see a community where there were already challenges and systematic barriers, and that really been amplified because of COVID. And really important for us to hear what we can do in that regard, not just in relation to food poverty, but more generally as well. And very interested just hearing that demand, the pressure coming from the ground where you weren't involved in direct provision and now are. And I'd be very interested to hear a little bit more on how we might unpack that. So thanks again. Tanya, I'll move over to you.
Good afternoon, everybody, and thanks a million for the invite today. As Denise said, I'm principal over in Our Lady of Lourdes National School in Golden Bridge in Dublin 8. This is my 26th year of teaching and my 15th year working in DESH. We're a school of 240 odd students. We're a very diverse community. We have 28 different nationalities and 11 different faiths. And, you know, the DESH grant is wonderful. It provides opportunities for our students to, you know, equalise the opportunities that they have. And we have traditionally provided breakfast club and after schools clubs, which would have involved, you know, food as well. With COVID, unfortunately, that has not been possible to continue, but we are very much involved in the hot meals programme. We were the proof of concept school back in 2018 for the now nationwide food programme. We started back in 2017, a group of us in this community got together and did up a report, and we lobbied the Department of Social Protection, Justice and Education as regards the acute level of disadvantage that's here in this community. You know, I was in Limerick for 4 years before I came here. I live and work in Sallynoggin for a long time, also in a desk, and the level of deprivation here is something that I've never encountered before. So when Minister Regina Doherty was looking for a school that might pilot or do a proof of concept for the lunches, the hot meals, we were chosen for that. So we worked with our lunch company Carambole in Limerick, for a good 6 months, and then it was interesting, you know, the children, some of the children had never eaten solid food. They live on diets of, you know, very watery cereals in the morning, coffee, packet soups, all of that. So there was a lot of illness in the children in the beginning. Not a lot, but there was a significant number that it was noticeable. Some of them had never seen vegetables, and they picked out the vegetables and they used to leave them on the tray. So we had to blend the vegetables in the beginning. Now they're eating vegetables now, which is great, but some of them had never seen vegetables. Some of them, you know, couldn't identify the chicken curry that we get in as the chicken curry that they get in the takeaway. You know, so those traditional dishes like spaghetti bolognese, you know, goujons and chips, all of those kind of things, they were entirely foreign to them. But we have put together a very successful menu. It's a very successful project. It rolled out to 36 schools, and ourselves, 37 schools in 19, and now 189 schools, 171 of whom are DESH. It is now in those schools. I suppose the COVID was an interesting learning for me, in that I thought I knew quite a bit about my student and family population, and it turns out I didn't know as much as I thought I did. And you know, the lunches have been going out to schools in boxes, and wonderful care boxes have gone out over the period of COVID and the shutdown, but it was slower than I would have liked to get going. So in the beginning, I was relying on the Vincent de Paul, the local parish, friends of mine who I'd ring and say, look, I'm looking for a donation here. Is there any way you can do a shop and deliver it? I was in Mayo, you know, so there was a lot of that. But things have come together now, and I think, you know, the children rely hugely here on the food that they get in school, and the spare lunches go down in a box outside, and everybody takes them home. And there are children feeding their families with the school lunches here. The food is of a very high quality, the children like the food. But it is a huge problem, and we are probably, I'm always talking about us being super DESH. You know, there is a place now for schools like ours who are in another level of DESH than is experienced in some other DESH schools throughout the country. So, you know, that's something I think that needs to be looked at as well. So it has been a very positive experience. It's a very complex issue, and certainly one which I'm so delighted to hear discussed here today, because, you know, if you look at some of the comments under the Facebook post from RTE News, when we were featuring on every news channel in Ireland for the pilot, you know, they're discouraging, and people I don't think have a proper understanding of what food poverty is. But anyway, thank you.
It's great to hear the experience, and I suppose again what you amplify for me is the importance of quality and choice, as well as the context, and that's vitally important, that people and kids have a choice and have good quality, and the difference that can make. Great, thanks a million. Okay, Eileen, last but not least.
Thank you. My sound is on, yeah. So I work with Ballyhurry Development, and we're a local development company, and we work in East Limerick and North East Cork. We are one of 49 local development companies across the whole country, and we're represented at a national level by the Irish Local Development Network. So I'm kind of here with two hats today. It was the ILDA, and I suppose they got in touch. So ourselves, we're like all the other local development companies across the country, and we manage and implement a huge range of programs, local programs, regional, national, EU programs. And I suppose when you're looking at social inclusion and responding to food poverty, the Social Inclusion Community Activation Programme, which people probably know as CICAP, it's the National Social Inclusion Programme, and it's one of the key programmes that local development companies like ourselves deliver across the country. CICAP, I suppose it's a key programme for us, and it's a key programme for communities that we work with, as well as it directly responds to food poverty and social inclusion, but it's the driver and enabler of a lot of other key local projects that react to needs that families, communities, children are facing in communities where we work. So I suppose some of the other programs that we operate, we have community and family support services in areas throughout our area. We've youth projects, we've a number of childcare services dispersed in rural communities across our area, homer clubs, we operate a traveller project. And I suppose Ballyhurry Development, and as well as all the local development companies across the country, have responded to food poverty before the crisis with this it significantly increased during the pandemic. I suppose what we found, and I suppose maybe unique, I'm not sure is it unique to us as opposed to what we were looking at is food as an engagement tool, because we always stood quite firmly that we're not a food charity and it's not the space that we want to find ourselves in. And are using food, responding to the very need the families need food, but to use it as an engagement tool, to look at all the wraparound supports and services, to try and attempt universal provision, to try and take the stigma out of what we're doing, and using food to get people in the door so that we can maybe address all the other drivers that are out there. And I suppose the important thing for us, and this is across everything that we work with, is that we try to work where communities and families are at. So just to respond where their needs are at that present time. And that was very, very real during COVID-19 when and I suppose what I might do after this is share in the chat or a case study we did on food and reacting to families in crisis, is that it was by a mistake phone call on a Friday evening that I got that we ended up delivering food. I didn't think we would be after the phone call on Friday evening, and next thing we were. And it's something we've continued and grown through the pandemic, and even more so now we see food as an engagement tool of getting families that are in crisis to respond to services so that they can be supported in a wraparound way, that it's not just meeting the immediate need of the family needs food. Thank you.
And actually that's coming up in the chat a lot, which we'll come back to, is the wraparound services. So food provision being because of demand, but actually the need for wraparound services to be included in order for it to be effective. Okay, I'm going to go to Q&A now, if that's okay with all of you. And Seamus, I'd love to come back to you if that's okay. So you have that national coordinating role for Meals on Wheels, but what I wanted you to do was just amplify some of the issues which are around older persons and poverty, and then related to food poverty that you have experienced and witnessed over the last while.
Thank you very much, Denise. Yeah, I think we always refer to a study that we cooperated with in the Vincentian partnership mentioned already with Social Justice Ireland, which shows that the income per household, and it was stretched over 6 households, is €100 more per week in rural households. And I suppose the biggest problem identified in that study, and which goes on every year, is of course transport. That's the first thing. So when we talk about trying to get cooperatives or local or even supermarkets or Aldi's or Lidl's or whatever you have, in some of these areas where isolation is a major issue, that's a problem that needs to be resolved. The second issue in terms of poverty, it is about income. It's also about losing capacity to manage their own meals, or to cook them, or to prepare them. And often, and that means also losing the capacity to drive can be a problem as well. So those factors, once they're brought to bear, influence hugely the kind of poverty. So it's not that people are starving, it's simply that people are eating foods that are maybe not the correct food for them, given their situation, and especially in older people, that's amplified in that way.
And Seamus, are there some measures or some good practice out there that you'd like to amplify in today's discussion, both in terms of older persons or indeed kind of the rural context?
Yeah, I think first of all, the awareness of this problem, because I do compliment the HSE who come on board with us on this, because they really have become very willing partners to try and resolve some of the issues. The main thing, first of all, is awareness, because some people didn't realize, and I'm quite certain we ourselves didn't realize the problem, and it really amplified itself in the last year. The second then is about empowering people at local level, either to develop kitchens or places to cook, to shorten the food chain, because what you have is loads of communities around the place where you could shorten that food chain to some degree. Now there's a wider solution, which is about shortening the food chain anyway, in terms of local producers, and that to me, in assistance to develop small cooperatives, would really help in this issue. But really, when it comes to getting prepared food or getting help to people, we have to find different systems of bringing that food. It's often just for a short time, but it's essential. It is the difference between a person coming home from hospital and having to stay longer at a great cost to the state. So we're trying to work with the HSE ourselves in trying to come up with solutions to shorten the food chain, to increase kitchens available to do the cooking and preparation, and also to give assistance to the transport.
Great, thanks Seamus. Bridget, you were talking about the many challenges that have faced your community, the travelling community. What are some of the measures that you'd like to see put in place to begin to address that? You're on mute there, Bridget. Bridget, we can't hear you, you're on mute. Rosie, I don't know if Bridget can unmute herself. You can't, okay. Rosie, are you there? Bridget, I'll come back to you. Emer, can you unmute yourself?
I can, yeah.
Brilliant, okay. So in the introduction, and obviously everybody knows Food Clouds work so well, that all those attempts to try and, I suppose, use food surplus to avoid food waste. You talked about some projects, the scalability of some, and I suppose the challenges on others. What are some of the measures you'd like to see in response to that?
Yeah, so I suppose just first off, there's a lot of organizations out there who did an amazing job over the last period of time and scaled up really quickly, and organizations that put in place food provision that had never even thought that was going to be their position ever. So the work that was done was amazing, but I suppose there could be a suite of supports available to organizations that meant that we have some level of standardization across how we provide that kind of emergency food support. And I think that there's a lot of work that needs to be done there in providing organizations with the kind of best practice for providing food, the kind of system of referrals for referral system that they can tap into and that they can be used by. Absolutely. And then like food safety supports, even how to scale up storage, because I think one of the biggest very big challenge for community food banks, and I think this is replicated very much in the UK, has been that it is ambient, non-perishable food only, and because they didn't necessarily have the resources to be able to take in fresh products, which means that the food packs that are going out obviously have a nutritional gap in them. So I think there's probably a very large suite of supports that we really need to kind of focus on and being able to provide out to the community if it can be made available. But then also I think the mapping of services nationally is a piece of work that absolutely needs to be done. And I think by doing that, we will be able to kind of move towards probably a more improved referral network. So where organizations, I suppose, like social protection, where MABs and the like are able to easily access where the kind of food support is needed, when that food support is needed. Because, you know, it is needed from time to time. There's a lot of people who transition through food poverty who find themselves in that place for if it's for 5 or 10 weeks. And so those supports do exist across the country. We know about them, but we don't necessarily have any kind of a formalized mapping of those kind of supports. And then I suppose finally, amongst our network, and it's something I touched on in the introduction, amongst our network, I think they themselves, many of them would feel like there needs to be a greater understanding of this issue, not only in how they should respond to it, but also kind of an understanding in a more nuanced sense. You know, what's their position in here? Am I only fighting against food poverty if I am providing food parcels, or are there other mechanisms in order to do that? And what are the other mechanisms, and how can we set them up? So I think that there needs to be a greater understanding of the issue, definitely across the community sector, and potentially a kind of stronger collective voice on food issues in Ireland, because I think that there is perhaps a bit of a weakness there in the sector, where we don't have yet a collective strong voice on food poverty and food issues in Ireland.
Great, thanks, Emer. Welcome back, Bridget. Are you okay? Can you unmute yourself now? Great.
I am.
Brilliant. No problem
I
at
am.
all.
Apologies about that.
Not at all. So I suppose just stepping back, Bridget, and observing all the kind of impact of COVID-19 on the travelling community and the kind of exasperated context, just what are some of the measures you'd like us to consider?
I suppose that the travel community are at a disadvantage given the high levels of unemployment and the high levels of people who may not have a formal education and who were denied in the past a formal education. We now have a new generation of children who find it difficult to go to school for all of the reasons outlined during COVID, but also prior to that. And a lot of it stems from poverty, whether that be food poverty, fuel poverty, not having a proper home. The children were at a disadvantage already. I suppose some of the learning from us really was around the documentation of that and the need to provide wraparound services, to work with other agencies and to work in an interagency approach to solve the issues, because I suppose it's really easy to advocate for your human rights if you have a full belly, a roof over your head, and maybe you're able to think straight. But if you haven't got your primary needs, or your children haven't their primary needs met, it's really difficult to come together in community development role around looking for, whether it be recognition of travel rights or recognition of cultural rights. So we feel that we have to put a very big emphasis back on getting back to the basics, like people having access to food, access to shelter, access to education. So two of the biggest things that have come up for us really in the organisation has been looking at the long-term, short-term, medium-term goals that we would have. The long-term would be to engage more people around innovative ways to get people back into training, employment, put some money into people's pockets, and to be able to educate people too and support people around different dreams they might have for themselves or their children. But also is to acknowledge the differences within the different communities. For instance, we would get a lot of travellers coming to us if we refer them on to other agencies. They're very glad of the food, but some of the food is not the food they would eat at home. So it's that research around the different minorities. What food will your child eat? We're lucky in that there is still a large knowledge around how to cook within the community, but we can see that diminishing. So when we were doing our parcels, a lot of families were asking for fresh fruit and vegetables and perishable foods because their children wouldn't eat the store cupboard essentials. Now that varied. We had other families where the ability to cook or the room to cook or having the facilities to cook had diminished, and they needed the pot noodles or the Insta soups, or their children wouldn't have anything. You know, that's a fact. They might have just access to a kettle to boil something in, or maybe not even that. So I suppose the learning for us is that there is more research needed, but there's more investment needed into empowering people to prevent poverty from the first place, and to look at the different geographical areas outside of Dublin. I live in Killarney, where rents are extraordinarily high, and the cap from the I suppose the housing supports don't match that rent. It's extraordinarily difficult for anybody to get accommodation. So you're already having high number of travellers in homeless situations or in overcrowded situations, living in very poor situations. And that only amplified during COVID, because when the need for people to self-isolate, people didn't have the facilities. Now, I have to say we weren't quarter as bad as people were in our neighbouring county of Cork, because we have, we're not as densely populated and we don't have as many sites, but we could have been in a very dangerous situation. And I imagine sites around the country, actually, I know sites around the country were in very dangerous situations, and the children there were. So the children, I suppose, already feeling very disadvantaged and hungry, and people having huge stigma and shame around not being able to provide food for their families was another learning for us. So perishable foods, having the long-term goals, but also linking with the other agencies who are providing the food and giving them our knowledge that we found from people. We also linked a lot with Meals on Wheels locally, who have been terrific in delivering meals to local to elderly people or hard to reach people, and also other food providers like private caterers, kind of getting contracts with them to be able to provide hot meals for people who might not have the facilities. But they're all short-term solutions really to long-term problems.
Thanks,
So,
Bridget.
yeah.
No, thanks. And again, it's come up on the chat and we'll come back to it, but that balance between ensuring that the underlying drivers don't get hidden in the provision of meeting the immediate demand. And again, you're coming back to the situation of choice and quality in particular contexts. And I think Bridget alluding to the Ombudsman's spotlight on some of the sites in Cork and just the disadvantage for the kids and families there because of the lack of basic amenities and access to just basic rights, which we all expect. And so I was delighted to see it amplified, horrified as others were at the lack of just basic amenities for a community of families. Tanya, you were talking in the chat as well just about some of the research, and again coming back to choice, I suppose, and as you say, a successful pilot and how you push it out. Just talk to us a little bit about that.
Yeah, I suppose it was a totally new learning experience for me because marketing isn't in my area of expertise at all. But I suppose it was about consultation as well with the children. The children had a huge part to play in it. You know, we have the student council here who were very active and very articulate, and there was a lot of consultation with parents, a lot of consultation with, nutritionists and all of the rest, and particularly about how to introduce nutritious food into children's diet. And as Bridget says there, like, anybody who gives their children pot noodle or whatever else, if that's all they have, well, that's the way it is, and that shouldn't be judged by anybody. Because people are trying to do their best and nobody wants to see their children hungry. But certainly, that whole choice as well. And like the children did reject a lot of the food. And then there was an issue then about, packaging and how you deliver it. But just, John was mentioning there about Cherry Orchard. And sure, we're all very envious of what goes on up in St. Ultan's. And I think, I think we're short-sighted in our planning here. I would love to see, education hubs. If I won a gazillion euro, I'd love to see an education hub in every area like our own, where there's a preschool, a primary school, and even a preschool where, young mothers who are expecting maybe their first child at 16, 17, 18 can get support and help around, nurturing and attachment. I think attachment issues are huge. And I think that creates a huge level of anxiety around food and all of the rest in it, later time. So I'd love to see that kind of a hub where there's, prenatal, preschool, primary school, and perhaps a secondary school with, the public health nurse, speech therapists and all of that who are on site. And I do think that, a designated public health nurse in an area like ours who only deals with nutrition and food would be so valuable. But I do appreciate that that's something that's very hard to evaluate in the long term, and then allocating budget for that when you don't have that evaluation is tough. But there are some of the things that I would like to see, and I suppose it has been very beneficial for our children here. And that whole thing about shame as well that Bridget spoke of, it's so important that children shouldn't feel in any way responsible for the situations that they find themselves in. And certainly we would have a very diverse population here. We would have some families who would be quite wealthy, but before COVID, but then both would have been working in the hospitality industry. And out of the 190 families that we have here, 152 took the food parcels all through the COVID and Christmas. And we give out, before COVID came along, we would give out 45 hampers at Christmas, very significant hampers at Christmas, and we would get that from charitable donations, and the staff do a collection as well. So we have been doing food parcels for a while.
And Tanya, I'm going to put you on the spot a little bit and ask you two questions. One is the food quality that's provided through the government schemes, is that good enough? Is there less?
It's lovely. Like the staff eat it every day as well. It's lovely. I like it. I enjoy it.
And the second then is, what do you do about holiday hunger? Or any comments that you have in relation to holiday hunger? Yeah,
and again, I suppose Christmas and Easter are easy to cater for here because we would have those 40 families, the really, really at risk or marginalised families. I think the whole thing about, building relationships is key, and the homeschool role in DEIS schools is really important. So, our families here know that they can ask for help. There's never it's grand, absolutely, we drop out a voucher. Some families get a voucher because they're well able to, they're in a position, they might have a car, they might live near Aldi or Lidl. Other families would, and I always give a choice, other families would prefer then just for us to provide the food, and they can either come and collect it or we deliver it out. But over the summer, I'm kind of concerned, and I know that the department are in talks at the moment about how we're going to feed some of the families over the summer. But it wouldn't be every one of those 152 families for us now. It would be it would be pared down to a quite significant but needy number, and we will be catering for those over the summer.
Great.
Regardless of whether we get the money from the department, we will.
Okay, great. Thank you very much. Eileen, can I come to you? And just two questions, I suppose. One is it new, the demand in terms of food poverty? And also you undertook a food education programme. Just to talk to us a little bit about the thinking behind that, the rationale, and how effective you think it was.
Thanks, Denise. I don't think it's new, but I think what COVID-19 did was it exposed it, and it brought to the forefront, and it pushed more and more families into a hardship situation. But I would definitely say it's not new. But what it has become is maybe the top layer, if you look at what are multi-layers of disadvantage that families are facing. But at the end of the day, I think it's poverty, whether it's food, fuel, heat poverty, it's a level of poverty the families are facing. And when it comes down to the crunch of it, if families are under financial pressure, it'll be food or utilities are the first to go. And I suppose one thing we did find is that families that never ever before needed support from any agency, no matter what it was, were putting their hands up and saying, what's gone wrong and where can I get help? And they never had that experience before. So then, yeah, our food project, and I kind of touched on it earlier on, that we kind of got here by accident. So we have done a bit of work with food. We've worked with Emer and Food Cloud, doing a bit of research and trying to encourage, I suppose, use of the Food Cloud services. We are also the Community Food Initiative leader in the CHO3 health area. So we would have delivered that for the last number of years. And it was actually through that where our food skills project came. So I think we were just kicking off our community project through our Community Food Initiative in March 2020 when COVID hit. And at that stage, I think the concern for us as an organisation was how are we going to deliver our project? It wasn't really looking at, I suppose, what we've come to look at now. And so we spoke with CCAD, another local development company who coordinate the CFI, and we decided to roll out a remote CFI, and the CFI, the Community Food Initiative, focuses on food skills, looking at healthy shopping, looking at budgeting, looking at cooking skills, improving access to and availability to healthy food options, and preventing food waste. So we started off, and I was kind of saying, the families are not going to take this up. It's going to be stigmatized, a bag of food coming to your door, you coming back and saying what you cooked that week. But I was wrong. We could have, I think we supported 40 families. We could have supported 140 families. It was to get involved in it. So what happened was one meal, 10 euro max, ingredients for one meal was delivered to a family's door. One of our staff members would phone the family and go through how to cook the food. They'd send them a YouTube video of how to cook the food. The family would send back pictures of them cooking the food, and we'd get feedback. And I think the comments were shocking that that was the only hot meal they got that week. It might have been the only meal. And it was when the drivers came to the family's door and was kind of telling them this is our only hot meal this week, or this is the only meal with meat this week, or this is the only time we used our oven, that never before had the oven been used in the house. Or so then I think another opportunity arose, and the Redemptorists in Limerick wanted to work with us in trying to overcome food poverty, especially because of the pandemic. And so we started giving out food packages every week. Food Cloud were one of our main partners there. But I suppose through it all, it kept coming back to us was engagement. How do we help these families rather than giving them handouts? We could see the crisis that they were facing, and especially families with younger children. Tanya spoke about the school meals, and a lot of families we were working with and fair play to the schools, got food packages out to those families. But what we were really finding is families that had younger children and weren't accessing services, or families in schools that didn't have school meals. There was real crisis going on, and Children's Rights Alliance was presented an opportunity. We became aware of it through SIPSI, and if I can remember correctly, that the call was about looking for agency to provide food to families, but it was something that we couldn't do. We knew we'd never be able, we wouldn't have the facilities or to be able to do it. So we said, look, our community food initiative really worked. See, can we roll this out again? So we did. And this time it was on a bigger level. We provided, I can't remember the figure, but it was at least 3 hot meals to families every day. But it was the ingredients for the hot meals. Staff member followed up, spoke through cooking it, sent the YouTube videos of people cooking it, followed up again to see how they got on, got videos back. It was just such a huge success that we've tried to continue it. And like, might be 10 families. If we get funding, it might be a bigger amount of families. And again, for us, it's trying to stay in the space of engagement, because we don't have the resources to make something an ongoing thing. So it's the very same as pre-pandemic, joining a 6 weeks community education course. This is joining a 6 weeks food education course, and it's trying to give people the skills and resources to be able to continue to meet the needs of their families. And yeah, hopefully, I suppose it's going back to the help out rather than the handout is the space that we're in.
Thanks, Eileen. I'm going to fire a few questions at you all now before I open it up to the floor. If I were to ask you from the learning of the past year, what needs to be done at a national systemic level to try and address food poverty? No pressure, sorry, as if that could be answered in a couple of comments, but you might give me your impressions. Emer, I'm going to start with you first.
Okay, so I suppose I would say that we need to think bigger. So rather than thinking about food as charity all the time, or that it's used to respond to food poverty and treating a problem, that this time is going to pass, and it won't be so obvious again at some point in time. And so I do think that we need to be thinking much bigger, and we should be using food as a tool to reduce the risk of food poverty and building resilience in our communities, as a tool for education and supporting communities. And also, I suppose, think of new interventions. So, I speak to, I think it was mentioned in the chat, but the social supermarket program that has been piloted in the north. So like social supermarkets are not an unusual thing outside of Ireland. They exist across the EU, and they come in a lot of different forms, which are very, very interesting. Many of them actually publicly open, and more like in a cooperative feel, which is an opportunity for people to access food in an affordable way, which doesn't have stigma, and has all the dignity of going to any other supermarket. So we would like, I suppose, to see it being looked at as in the much bigger picture sense. And I suppose, at core of that is that we would love to see the government as being a leader in understanding and in responding to the issue. And of course, as well, we welcome the interest in the establishment of the new food poverty working group to this end. But I think that, I hope that people would agree that it cannot, the book doesn't stop with government either, that there needs to be kind of new innovations and new approaches that are community-led. And we know that communities have really fantastic, like you heard from Eileen there, fantastic approaches that need to be tried out. And when you see them working really well and the impacts of them, like, they're a really fantastic proof of concept. And we see those ourselves. We see in Donegal there is a community centre that has created like an environmental hub where they are spreading kindness through teaching people about the impact of food waste and the rest. And throughout the COVID-19 pandemic, they continued doing that, and it was a tool of engagement. It was a way of keeping the community together and keeping them engaged. And at the same time, people who needed support were able to get it without being highlighted or without being pulled out or identified. So we know that communities actually are the ones who need to lead on testing and finding out what the appropriate responses are. But we would like to see at a national level that there's more support and understanding of the complexity of this issue, and therefore the complexity of the responses that need to be put in place.
Great, thanks. Seamus, I'm going to go over to you. Any learning that would feed into a national response to the systemic issues?
Thank you, and apologies, I'm now using remote via phone, so the technology is wonderful. Yeah, I think the systemic, you asked the question, systemic approach. First of all, I would say let's get real about the role food plays in our lives. When a person has been discharged from hospital, they're given their medication, they're given a whole range of advice. They should also be able to get some sort of assistance in terms of the question, are you going home to your own house? Will there be anybody there? And if not, here is a service, or here is a system that can bring you automatically the food that you will require. So at least get that into the thinking. The second thing, I know DESH schools provide some food, but not all schools, especially in rural areas, are DESH. So we really need to look at not just the provision of food in schools, but the way it's cooked and the way it's managed. And also the students of all ages and of all genders get to know how to manage, cook, and understand food. That's the systemic way of looking at it. The third thing I would ask simply that we look at the availability of local food production systems, whether they be shortening the food chain, whether they be assisting with community groups who are already developing ways and means to
Seamus, your internet's going in and out. We've lost you. Okay, I think we'll have to let Seamus come back in the interest of time. Seamus, we can't hear you with your internet. You're coming and going. Okay, Bridget, I'm going to come to you. Again, any learning that you think would inform addressing the kind of systemic issues at a national level?
I suppose just around the creating opportunities to have more income and capacity in people's homes. So money alone, because if it isn't enough, it could be around, supporting people around training, development for themselves within some of our community, and supporting them to have purpose, supporting people to be able to support their children around making good choices and having maybe the choice, having the income, but also the facilities to be able to make those choices, because we see people buying bags of messages, but maybe not having a fridge, bags of food, but not having a fridge to keep them in. So sometimes the food goes off. There's a whole thing that needs to go there. A review. We have a very good opportunity now, post-COVID, or while we're still going through it, to look at children who are already at a disadvantage. So traveller children, children of people from with children with disabilities, children with different abilities, children in direct provision, children who are already at a disadvantage. We need to look at the impact of COVID more closely on those children, and to get research from the ground to be able to hear from the people and the children themselves what would change their lives, because we can't continue the way we were going before, Denise. We were already at a disadvantage. These children were already at a disadvantage. And with the report card after report card from Children's Rights Alliance highlighted these children. So we knew if thinking straight, we knew if anything would happen, these children would be the first to suffer. unfortunately, what happened through COVID is that many people who might have never suffered before have suffered. So we've even more children now in the mix. So I suppose my big thing would be around looking at the longer term goal at developing the capacity and resources and supports for the parents to make sure that no child goes hungry and that people's income is adequate too. We look at the ring taps, we look at the rents, we look at people, what do people actually have to spend on food?
Thanks, Bridget. Yeah, absolutely.
Sorry, my internet connection is very unstable today.
No, that's fine. That was really clear as well, as always. I'm just going to go through some of the conversations in the chat, and if anybody wants to add to them. I think one of the issues raised by the Heart Foundation, which is absolutely right, and we've discussed it already, where you are trying to balance the direct food provision with not masking the underlying levers. And Bridget, you've mentioned that a few times, as have others. And I'm going to, when I go back to Tanya at the end, I'm going to ask Tanya to comment on that. Is there an appetite for a social supermarket, as in the North, could be expanded from the co-ops? Midwest Simon have completed a feasibility study for a social grocery in Limerick, and they're looking for funding to set one up. The one in Northern Ireland received funding from the government this time last year. Another one from Crosscare, who have been doing this work for many years. And Yvonne rightly says, again, just the issue in terms of quality food provision, but also being able to ensure that there's wraparound services to support that we can adapt and pivot. Is there anybody else from that's attending that would like to add something to the conversation? Any of the other organisations?
Hey, hello.
Great.
Can you hear me?
I can.
Hey, yeah. My name is Louise O'Neill. I manage the Family Resource Centre, Astor Family Resource Centre in Balbriggan.
Hi, Louise.
How are you? Just to say, we have a food bank. We give people parcels fortnightly now. We are not an official food bank, so like that, the Family Resource Centre was only set up in 2018, and we work under the 5 national outcomes, brighter future, and we identified the need of the food poverty. So people coming fortnightly. The list is getting higher again. Pre-COVID, it would have been regular. More than doubled during the pandemic in March 2020. Like that, we closed to the public, and we thought, how can we still engage with people, support them? The only thing we could do, like most organisations, was address the food poverty. So we actually were out delivering parcels to 2-3 times the amount who had been coming into the resource centre. So I suppose we're always at local platforms saying there's a need for a food bank in the area. There is Meals on Wheels as well, and I know there is a soup kitchen which is run privately by a businessman. I think everyone needs to, as you say, come together on a local level. It needs to be more coordinated. But other things we do is we are family support service as well. So we have a programme called Household Assist. So it's about people with their budgeting issues and stuff like that. So again, it's kind of that educational piece, you know, about how spending your money, budgeting and stuff like that. We also have a Cool Kids Club, which is healthy food made easy. And one of the benefits, I think, of COVID and Zoom was children and their parents were able to prepare the healthy meals at home. And it kind of took they were able to do this at home. They were able to share the food then that they cooked. It was, you know, the healthy food made easy. So it's healthy food on a budget. That's really has been successful as well, you know. The other thing we have had is a homework club, which was very targeted. So it was like children from traveller communities, people in emergency accommodation, and children from the Roma community. And we would have provided a hot meal for them twice a week coming into the homework club. So addressing the food poverty thing, that went well. But another thing that came up then, we have been talking about quality and choice. There was like some of the children, so what we were faced then was some of the children are halal, because as you know, Balbriggan, it's the different communities. So that's something then we had to make sure that, you know, we were following with that. So our food bank, it's non-perishable goods mainly from feed. We have linked in with the food cloud, but the issue was the stuff was kind of best before or use by. So we couldn't be giving that out to people to follow the HSE, you know, the standards we had to keep. So that kind of was an issue as well, you know. But again, definitely in Balbriggan and in all the local communities, and I think probably a lot of the people here were delivering these, providing these services, but actually we are not the food bank or the thing, it's an unofficial thing, and that all needs to be coordinated, and all the organisations in the localities coming together to have it managed properly, you know. And I think the other thing is what you're saying, it shouldn't be a stigma thing for children, so just all children being treated equally and the same. And the last thing I'm going to say on a personal note, being only on social welfare 30 odd years ago with 2 young children, and if that was your only income, you don't have a choice. When everything was paid with your money at the end of the day, there was no money left. Thanks for that.
Thanks a million for amplifying all of that. And I think the point you make about the kind of informal provision and then also the diversity of need in terms of choice is huge. And absolutely, what is choice then at the end of the day if your income level is prohibitive? Thanks a million. Okay, I'm going to go to Paki, and then I'm just reading the name on your screen, and then to John. You're on mute.
Sorry, can you hear me there? Yeah.
Yeah, we can hear you now.
First of all, my apologies for being late. I suppose Chapter Family Resource Centre, man in town, we're like much of the other partners here at this meeting and most of the family resource centres. But particularly here in Monaghan, we had the lead for developing all of the food banks during the COVID crisis because we had experience of it before. And, you know, we, like others have said, we are seeing those who are living in poverty before the pandemic and will also be after this pandemic. But particularly we're seeing a new cohort of what we're calling is PUP families, those who are on the PUP payment. And currently in the county of Monaghan, there are still 6,000 people. There's an unanswered question about how many of those will remain recipients of our food bank. But I suppose in trying to move it on, what we've been looking at trying to do it strategically, and would be grateful for any advice or support, is that we're trying to develop a food poverty policy for the county, because we're leading out on an interagency stuff, and some of the stuff that we're seeing is that we're doing a questionnaire with our regular users and some of our new users, which is rather sensitive because of all of the issues of people accessing a food parcel as such. So that audit is currently ongoing at the minute. What we're seeing is that in the county is that it's interesting to note that most of the families are coming from what we would call is the hot spots in the county, those areas of social economic disadvantage, and we're trying to certainly reshape or refocus the likes of our SICAP program, where we sit on the subcommittee there, to be working in those hotspots. It would have had a scattergun approach, so we're looking for a more focused approach. But that idea of trying to develop a food poverty policy as to why people are accessing it, which is all of the issues that people mentioned here today in regards to fuel poverty, in regards to poor educational issues, in regards to skill base, all of that kind of stuff. I would have to say that it's certainly meeting some resistance at an agency level, but we're keep trying to nudge that forward. So again, any kind of advice or assistance or help in that kind of area would be useful. So we're trying to move it on to the next stage, you know.
Yeah, brilliant. Thanks very much, Max. Thanks for that. I'm just going to move quickly because we're actually coming to the end now. John, you have a couple of comments, and then I'm going to come to Karen.
Yeah, just I suppose loads of it has been said. Yes, there's money. There's issues with money and food poverty and people not having the money to buy the food that they need. But in a lot of cases, and I suppose the thing that we kind of felt was that food education, the importance of education of food, why it's important. The HSE through COSI or whatever that organization was, had a study, I think it's the 5th one they've done, where they did obesity and overweight in primary schools. And you found that disadvantaged areas have twice the levels. Some of that is down to just the convenience of fast food outlets that are everywhere in disadvantaged areas, more so than others. But at the end of the day, like, we provide a hot meal for every child here, and we've been doing it for 10 years, and we cook on site. But we still have difficulty with people eating vegetables, so it's COVID has really shown us the things like education and understanding it, because, you know, health is both health and behavior, actually, and because behavior becomes affected by not having the right foods and not having food at all.
Great, thanks, John. Karen? Thank you.
Good afternoon, everybody, and thank you for the contributions today. It's kind of observational, really, as much as sharing an experience from GIY. What I'm most struck by, I think, from what I've heard from the panelists, is how, and I understand that when talking about food poverty, it is to address an immediate critical need, but it's talking about food and provision of food to survive. And the question I guess I have is, what about providing food through skills, through direct provision, etc., that is to thrive? Bridget, you referenced earlier about how could we expect anybody to address a bigger issue without, you know, whilst hungry and not having a bed to sleep in and all the kind of things that everybody is entitled to do and lots of people take for granted. And again, when I'm listening here, I'm thinking, if we continue to give people like what is not the best quality of food, because it is highly processed and because it's perhaps produced and provided more cheaply, because it has to be done at scale, and also there's a profit element to it, then what we're doing is keeping that cycle of food quality on the go. And I strongly feel that removing and acknowledging the need to provide people with food as a critical need in the first instance, if we elevate the quality of food that we're given, then we're elevating the people to whom we're giving it to. Do you know what I mean? And so therefore we're investing, and I know we're talking a lot about children today, and you saw my two here behind me. It's like that we are investing in the next generation of decider makers and influencers. But if we keep feeding them, or they are only given, it's not us, my apologies, if all the system's solution is to keep in the range of the pot noodles and the carambola and this, that and the other, then we're not ever going to break through what, you know, by giving them really good food and bringing them up as kind of active citizens. And I think that's a concern. And I also, I firmly agree with the need for us to localize the solutions, because not only does that address a number of other issues that are being talked about on other forums, whereby you have local solutions, local small businesses, local enterprises working together to address that local problem. But again, by the provision of food in that first instance, connections are made, people are seen, and then other solutions can be resolved. And by that I mean anything from a conversation that may take place at the door or in the community centre, but suddenly that's where a job opportunity might come, or a bit of seasonal work, or did you hear about this course, or whatever. And so the skills that are needed by all of us to succeed, they then are served up and talked about over the dish or over the dinner or over the whatever is provided. And I 100% agree with the need for us to get back to basics, to recognise the critical importance of home economics and all that goes with that, and how if we don't know how to budget for food, shop for food, cook our food, grow our food, store our food, you know, bearing in mind the need to have the facilities that will allow us to do that. But if we don't have the know-how, then we will always be relying on somebody else to do it for us. And that is not resilience, and that is not sustainable. And that is just keeping the problem going around and around. So I say all that, hugely grateful to you all for the work that you're doing, hoping that GIY can be part of the solution in some make, shape or form, acknowledging the complexity of it, and at the same time knowing that there's huge power in the simplicity of going back to basics as being part of the solution.
Great, thanks, Karen. We've actually run out of time, so we're going to end on those wise words. A huge thank you to our hosts, to the Children's Rights Alliance. I'm going to pass back to Tanya just for a final word before we head off. Thanks to all of you for your contributions, to our panel, Seamus, Emer, Bridget, Tanya, Eileen, thank you so much. Thanks to our Rosie for organising us, and to Seamus as well. So Tanya, back to you, and thanks to all our contributors.
Yeah. Wow. Okay. Look, thanks everyone. That was such an excellent session for us. I think if anyone wants to learn anything about food poverty, this was the event to be at, because what you really got, I think, from all your contributions is the complexity of this, and just the huge level of need. To be honest, what really disturbed me was the level of demand coming through from all your inputs, that once you started one thing, there was a huge level of demand. So that's obviously telling us there's a lot of unmet need out there that's not actually being reached. And what a lot of you're saying is actually you're underfunded to do. You're doing great work. You're being really creative. What really struck me was the responsiveness and quick thinking and agility and the way you were adapting, to based on the need. But actually, you needed a lot more support to actually work with the communities that you were working with, and that's what really, really struck me. Look, the diversity in need, and look, even hearing that families don't even have facilities to cook food, because it's great if you can actually focus on the cooking and storing, but if you're not even able to actually store food and cook it yourself, they're really at a very low ebb, and we really need to respond to that level of need. It's the quality piece is really complex, because obviously you're trying to respond to meet the nutritional need for people, and at the same time they have certain desires and wants, and then you're also trying to promote certain types of food. So what really came from it was you had worked out different ways to do that as well, and the education piece is really critical for children and young people and families at all levels. That's really something we should be getting back to basics. I really like that way of framing it, but it was really clear from all of you that was coming through. The other bit that really struck me as well was the need for the wraparound. The wraparound is critical. All of these initiatives, what really works well is you actually have all these other things alongside it. So, and that's really critical. And we should be thinking bigger, actually. Any of these interventions actually are opportunity to bring people into other services that could help them, because there's probably lots of other stuff going on behind the scenes that they need support with. The other bit was, I think, the empowerment bit, that if you're doing this right, you should be doing it in a consultative way with the people, the children, the young people and the families you're working with, and empowering them through this instead of just imposing a particular approach. And that was something I thought, the values-wise, I thought was really important, that came through for me as well. And the pieces around income, that it's absolutely critical. You can't actually live in a healthy diet on welfare payments. We know that. Some of you have direct experience of that. That's documented by the Vincentians. We know it when we talk to families directly as well. And that's something we need to address. And I think what was good for me as well, that you all understand, as you do, the difference between that UK situation and what's happening here. The UK, the Tory government have gone in, they have ripped up all their child poverty initiatives, and they've cut welfare payments because they know a Tory press, effectively Conservative press, had pushed cut welfare payments, and it helped them get elected in. Cameron get elected in, and that's what they've done. And their people are up with income issues, are living off food banks to the scale that hasn't been seen in the UK since the Second World War. So that in itself is obviously a warning. But here, I think what's coming up is people could see actually why they're actually very important here in very particular situations, and families have fallen on hard times, or they've lost their skills and capacity. They themselves don't have capacity. But I think the other thing that comes through, and again it disturbs me, but I've heard this, I suppose, is the resilience piece that's so important to support families. But when I've heard some of you talk about this, and I've heard this before, when children take the food they're getting from the school and they bring it back home. I've heard that before. Bernard has told me about a case where there was a child who wasn't eating the food, and they thought the child had eating disorder. And when they dug a bit deeper, it turned out that he was feeding his siblings at home, and he was only 5. So there's so much need there, and children themselves need to be supported and empowered. And I think what we need to do here now is think about what philanthropy can do to actually help this situation there's a huge level of magnitude of need is the issue, but there's also lots of solutions as well. And I think it's very welcome that there's going to be that there is some work being done at a national level by government in this space, because we need everything happening at different levels if we're going to address this really critical and important need for children and young people. So thank you, everyone. And it's great that the Community Foundation has recorded this, because I think this will be of huge benefit to lots of different people to listen back to it.
Great, thanks Tanya, and thanks everybody. We've run a little bit over, but I think it was a fantastic session. Thank you all very much.